News. The calls are growing louder for Prime Minister Andrew Holness to cancel the 1 a.m. curfew for New Year's Eve. The calls come amid an increase in the country's Covid-19 positivity rate, fueling fears that Jamaica is already in its fourth wave. Anthony Lugg has details.
It's been a while since Jamaicans rang in the new year with the usual fireworks and excitement. However, some Jamaicans are hoping 2021 will be different despite the imposition of a gathering limit. In some major cities across the world, those hopes have been dashed. All that is due to another COVID-19 surge and the rapid spread of the Omicron variant. Back home, medical experts have been weighing in.
The 8 p.m. curfew should be put in place immediately. We should not extend the curfew to 1 a.m. It is courting disaster.
I think they should look very, very carefully at this thing. It might not actually help us for this weekend anymore. The wave is going to be upon us.
Over the Christmas weekend, videos circulated showing hundreds crammed inside venues at illegal events across the island. The country's positivity rate has also jumped significantly.
There's no doubt in my mind that we are at the beginning of a fourth surge, which could prove to be far worse than the third. Let me remind all those listening at this point in time that this variant is 8 times as transmissible as the Delta. It is evading vaccine, it is affecting the vaccinated and the unvaccinated. But the population at greatest risk is the young and unvaccinated. The listener should also be told that it doubles the rate of spread every 2 to 3 days.
The first through to the third wave of the COVID-19 pandemic had a devastating impact on the country's healthcare system. And with a fourth wave now looming, there are renewed concerns about the country's hospitals' ability to cope.
At one stage during the Delta surge, we had 820 people in hospitals. And during that time, oxygen was running out, people couldn't get any beds, doctors and nurses and everybody home sick. All the facilities were overwhelmed. If we have more than that, without an expansion of the capacity, then we are in for a very rough ride.
But despite those assertions, opposition spokesman on health Dr. Maurice Guy says the cause for the government to consider cancelling the 1 a.m. curfew for New Year's Eve would be premature. He says the positivity rate should be assessed on a weekly basis to determine if there's a trend.
The reality is that the weekly positivity rate is a better reflection. It might be that we are seeing greater numbers, but we cannot rely on the 1 day or the 2 days of 12% and then 20% positivity rate to say that we are seeing an increase.
But Dr. Bailey strongly rejected that suggestion.
We cannot wait and see. We have to remember that the variant is 8 times as transmissible as the Delta, and it doubles the rate of spread every 2 to 3 days. Therefore, there's no doubt in my mind that this is the beginning of the fourth surge, and that we will see higher and higher positivity rates as the days go by.
Anthony Lugg, TVJ News.
And Jamaica recorded 161 new COVID-19 cases from 1,202 samples yesterday. The overall case count is now 92,950. The positivity rate stands at 14.6%. There were no new COVID-19 deaths in the last 24 hours. The island's death toll remains at 2,464. According to the Ministry of Health, 86 patients are now hospitalized with the respiratory illness, and 16 of those patients are severely ill, while 4 are critically ill. 150 more people have also recovered from the respiratory illness, increasing the recovery count to 65,332. In the last 2 weeks, there have been a total of 774 active COVID-19 cases. At the same time, 560,561 people have been fully vaccinated against the virus. A new research has revealed most Jamaicans do not trust the motive behind the government's vaccination drive, causing continued low take-up. The research was conducted by the Northern Caribbean University. O'Shane Masters tells us more.
A target of 65% vaccination by March 2022 is in jeopardy as fewer Jamaicans are going for the jab locally. Only about 19% of Jamaicans have been vaccinated against COVID-19. But why is that? Director of Institutional Research at Northern Caribbean University, NCU, Paul Bourne, says that has to do with trust.
We are seeing that only 19.3% of Jamaicans trust the government. And many persons do not. Many persons think that there's a sinister motive behind the vaccination. So if they do not trust the government and they think that the campaign has some other plan or some other things to do with it, then what does that mean? That they are going to be reluctant to be vaccinated.
Mr. Bourne says, based on the research from his team, approximately 64% of Jamaicans believe that there is an ulterior motive behind the vaccine initiative. Based on that fact, he says the government should not be the ones leading the charge.
Because 7 out of every 10 Jamaicans say that they will be vaccinated if they think the vaccination is working or if they think the scientists are coming out and actually letting them be told what the vaccination is all about. So the doctors, the epidemiologists, the virologists are the first should be taking the charge as against the Minister of Health and the Prime Minister and other government members related to the vaccination.
There were also concerns that the vaccines were being forced on Jamaicans. Mr. Bourne says 55% of the respondents believe they were being forced to be inoculated. He says if that messaging continues, it could be detrimental to the goal of receiving herd immunity through vaccination. He is also calling for a revision of any policy to institute mandatory vaccination. 1
in every 4 Jamaicans at the moment is vaccinated, which means that 3 in every 4 is not vaccinated. So if you're going to use a mandatory vaccination and persons think that there is a motive behind what you're doing, then what you're going to be having is chaos if we were to have any other outbreak of this virus happening in Jamaica. Because people do not trust you. They think that there's a motive behind what you're doing. They think the campaign has some other reason behind it. So what we are doing, we are alienating the people. So if you were to use mandatory vaccination, or people think that you're enforced to be vaccinated, then what we're going to be having is most Jamaicans looking in to be vaccinated and won't be vaccinated, even though they think it's important.
The research titled Jamaicans' Decisions on COVID-19 Vaccination, a national cross-sectional empirical survey, had a sample size of 1,074 respondents across the 14 parishes in Jamaica. It has a margin of error of 5%. O'Shane Masters, TVJ News.